It's very nice seeing you after a long time. I mean, actually we met recently, but it's very long time after I came here for my another procedure.
Yes.
And
meeting again at our clinic.
Exactly.
Long time. Last time was almost 12, 13
15 years.
15 years.
More than 15 years ago. It was.
So, one thing, your result shows clearly that the hair transplant does not reverse. Means hair transplanted hair do not fall off after 2 or 3 years. Right?
That's right.
That's what we say. They keep on growing throughout life if they are taken from the safe donor area.
That's right.
Great to have you with us again.
Thank you so much. And I have few questions actually.
Yes.
And these are the questions that I normally get from my subscribers. And although I can answer them, but I want you to answer them so that they will understand better.
Yes.
Because it is coming directly from the from the authentic doctor, and in my opinion, you are the best doctor in India.
Thank you.
And also the most affordable when it comes to quality and cost.
Value for money.
Exactly.
Thank you.
Okay. And there is one question, and this is, I would say, even my own concern and question as well. Some people will have thinning of the hair, not like completely clean bald head. So, but they want the hair as well as possible. They don't want to wait for something to work like micro needling or some other. They don't want to try, but they want the hair right away. Maybe because they got some marriage schedule. They don't want to be bald at least for a few months. So, if we transplant hair on that person, is it like it is going to damage more of his own hair, or is it okay to do transplantation for the thinning part of the hair?
Right. Thank you. That's something which a lot of people are asking nowadays.
Right.
See, it is a gradient. Like if you have lost up to 40% or 50% hair, then I will not advise you to put any more hair in between those hair. There is chance of damage. But if you have lost something like 70%, means the area has hair, but it's very thin, then we can definitely transplant. So what happens is, in areas which are at least 70% thin, we will notice some very well-defined spots. So we can fill all of them.
Okay.
Just one thing which one has to remember. See, those are thinning hair. Means every time with each cycle they grow to a length which is usually shorter, much shorter than before, and then they'll again fall down.
Okay.
So in a transplant, when we trim those hair, which are in their, some of those may be in their final cycle. After that cycle, they may not be coming back.
Okay.
So you cut those hair and then you put the hair in between them. Then that hair will not be lost because of the transplant, but in its normal cycle.
Okay.
Similarly, when we put grafts in an area which is thinning, remember those thinning hair are also growing slow.
Okay.
So when we cut all of them, put the grafts in between, then it is not that they'll grow back very fast. They'll also take their time. If your normal hair is growing back in, let's say, 1 month, they may take 2 to 3 months. But they will grow back. So all these things is something which confuse people sometimes. They think maybe putting the graft has led to this. No, it is the normal cycles which are going.
Right.
Whenever as a doctor I can find any empty spaces where I feel that yes, if I put grafts, it can help the patient without damaging the hair, I do that.
Okay.
But again, I explain these things to avoid any confusions.
Right. Okay. Got it.
So we can put, but you have to be careful.
Okay, got it. And again, another question, this is also my question only. So, I came here with lots of questions in my mind. So, for example, I have a decent thickness in my flat wherever the hair transplantation is done. And I have, see-through look and thinning in the crown area. Now, I want to fill this crown area. Then, in case if I am too greedy, and if you want to thicken more, and I know that I have very less crown area, but still if I want to have little thickness in the middle somewhere here, how can we do that if the donor from the hair is very less?
Then we will use your beard hair. That is one of the strongest hair which we can use
Okay.
apart from the scalp donor hair.
Okay.
And even in the scalp donor hair, I would like to point out this thing that only this part is permanent, not the one above it, right? So this is a small quantity. So when we need more donor, then beard is the next best donor. So if we need to thicken up any place in between, we can always use beard grafts.
Okay.
We'll do so in your case if required.
Right. And I have one strange question. I don't think anyone has ever asked you this question. And this is again my own question.
Yes.
I have these things in my mind. I just want to get these things clarified. So normally what we do, the single hair transplantation will be done on the hair. And how it will look, I don't know. I'm just asking this because I want to know the answer. How it will look if we transplant some body hair in the hairline, which is very thin. Maybe we will take it from some other chest area, some other area. Will it look more natural if we include hair from the back, also from the donor in the hairline?
See, for many years I have been doing this particular thing, which I normally say is, in terms of art, it is the fine limit of art. Why? Because we put around 20 to 25 fine hair in the hairline. Those are hairs which I can get from the chest if your chest hair is straight, or sometimes from the nape area in the neck.
Okay.
Again, those are thinner hair. We want hair which is thinner and shorter than the normal hair, because that is how hair sometimes grow in nature. If you see in a young person, he will pull his hair back and you will see some fine hair.
Right, exactly.
So for that fine hair, it's not a lot of grafts. It's somewhere between 20 to maximum 50. And we can put it in the front row mixed with your own hair, scalp hair. So that gives a feathering effect, which is much better than just doing zigzag.
And those thin hairs will be body hairs?
Yeah, body hair.
Okay,
Those will be either body hair or
Okay.
nape hair. These are two categories.
Okay.
So it will also depend on person to person.
Right.
Like if you have a very curly hair in the chest, then I will not use it. You don't
Okay.
want a curl hair.
Right. Okay.
It should be matching your head hair.
Okay. So this is actually already in practice, like
More than 10 years.
Okay.
But this is something which is not very talked about.
Okay.
But yes, we have been doing it. It's really nice.